Hello to everyone. In this video lecture, we are going to discuss arrhythmias. Arrhythmias is a special condition related to heart. During this condition, there is an irregular heartbeat. To understand the disease arrhythmia, first of all, we have to look at the anatomy and physiology of human heart. So if we look at the diagram of a human heart, It, it is it consists of four chambers. There are two smaller chambers which are known as atria, right atrium and left atrium, and there are two larger chambers which are known as ventricles, right ventricle and left ventricle. These four atria and ventricles contract and relax simultaneously and pumps blood to body and to the lungs. To make them contract, there are two neuromuscular junctions, two neuromuscular tissues present in the walls of heart, which are known as SA node and AV node. SA node, which is also known as sinoatrial node, which is embedded in the walls of atria, it produces a kind of electric current or signals which stimulate heart chambers, which are atria, to contract, and then some of the nerve impulses produced by SA node also reaches to the AV node, which is present in the wall of interventricular septum, and this AV node produces electric signals or current to stimulate the contraction of the ventricles. So when there is something problem in these nodes and in the problem in the signaling issue of the heart, then there is an irregular heartbeat, which is known as arrhythmias. Arrhythmias usually happens in our normal life. When we do exercise or we are having anxiety or fear, our heartbeat increases. The speed of heartbeat increases. But when we are at rest or we are sleeping, our heartbeat slows down. But abnormal increase in heartbeat or abnormal decrease in heartbeat is usually known as arrhythmia. So first of all, we are going to look at the symptoms. So what are the major symptoms of arrhythmia? Number one, a fast heartbeat, more than 100 heartbeats per minute is known as fast heartbeat, which is a sign of arrhythmia. Usually arrhythmias cannot be felt, so we have to use stethoscope or we have to use ECG, electrocardiogram machine, to record the proper heartbeat of our heart to determine whether it is having arrhythmias or not. A very slow heartbeat, less than 60 heartbeat per minute, chest pain, shortness of breath, anxiety, fear, phobia can also be the sign of arrhythmia. Sweating, dizziness, feeling tired and fainting or nearly to faint. So these are most important symptoms of arrhythmias. But if the patient is going to become faint or it has gone into the condition which is known as fainting, then we have to call emergency and treat the patient accordingly in the hospital. What are the causes of this arrhythmia? There are multiple causes of arrhythmia. So number one is heart attack or scares of heart attack. A person having heart attack, due to the heart attack, the muscles of the walls of our human heart become weaker. That is why they are unable to contract and relax normally, which can cause arrhythmia. Blocked coronary arteries. Coronary arteries are those arteries which supplies blood to our heart. Due to high cholesterol level in the blood or plaque formation in the arteries, sometimes these arteries become clogged and there is poor oxygenation of blood to the tissue of human heart. So that can lead to arrhythmia. Diabetes is also major cause. High blood pressure, sleep apnea, genetics, stress, anxiety, fear, phobias, etc. Cardiomyopathy is a condition of muscles or valves of human heart, and different use of drugs, alcohol, caffeine, nicotine, and some other drugs can also lead towards arrhythmia. Now we are going to discuss some important types of arrhythmias. There are different types of arrhythmia. Number one is tachycardia. Tachycardia, it means fast heartbeat, which is usually more than 100 heartbeat per minute. Bradycardia, which is slow heartbeat, and it is usually less than 60 heartbeat per minute. There are also some other types of uh, arrhythmias depending upon the tachycardia or bradycardia. So if we look at the types of tachycardia, there is number one, atrial fibrillation. During atrial fibrillation, what happens? Chaotic heart signaling. The heart signaling of SA node and AV node is not proper. Usually when this signaling happen, our heart produces a sound known as loop tup. So when the signaling is not correct and it is very irregular, then our sound of the heart and the heartbeat become also irregular. It will become loop tup, loop tup, loop tup, or loop tup. So it can go anyway. So the heartbeat will become rapid, uncoordinated, and this is a condition of atrial fibrillation. Another condition of fast heartbeat is supraventricular tachycardia. During supraventricular tachycardia, there is an irregular heartbeat of ventricles. These are the larger chambers of human heart, and pounding heartbeat that starts and stops suddenly. It feels like that heartbeat has stopped, and at the other moment it feels like our heartbeat has started again. So this is also due to the signaling problem. Ventricular fibrillation, it is also a rapid signal cause chambers to queer. In this condition, very fast and very rapid electric signals are produced by SA node and AV node and causing the contraction of ventricles. Ventricular tachycardia, which is also known as faulty electrical signals. SA node and AV node are not properly sending signals to chambers of the heart. As a result of that, rapid heartbeat of ventricles. If we look at the types of bradycardia, there is a sick sinus syndrome that is usually occurs in the old age where there is a deficiency in the function of SA node, sinoatrial node, and it cannot produce proper signals, proper electric current to stimulate the chambers of heart. So the heartbeat becomes very slow. And there can also be a conduction block because there are certain neurons, certain tissues which provide these signals to the walls of the heart, and if there is a blockage in the signaling neurons or tissues, then there will be less or slow heartbeat, which can lead towards bradycardia. So if we look at the treatment and diagnosis, so there are certain tests like ECG, and with the help of stethoscope and other cardiac tests can be performed to diagnose arrhythmias, but the treatment will be according to the main cause. So if the arrhythmia is due to an heart attack, then we have to treat with some medications. And if arrhythmias is due to blocked coronary arteries, then a surgeon tends to open those blocked arteries with help of a stent or some other medications like blood thinners. If the arrhythmia is due to diabetes, then we have to treat diabetes. If it is due to high blood pressure, then we have to take some medication to lower the blood pressure. If it is due to sleep apnea, then we have to take care of this problem. Genetic causes usually cannot be cured completely, but with certain use of medication, we can regulate our heartbeat. During stress or anxiety, we have to take certain medication to treat anxiety, and during cardiomyopathy we have to treat the real cause of heart problem. If there is a problem in the valve, then we have to open that valve. If this is a problem in the heart muscles, then we have to perform surgery to treat that issue. Less intake of drugs and alcohol, nicotine and caffeine may also regulate arrhythmias. So what we can do, we can take a healthy diet which is rich in omega-3 fatty acid or such foods which are good for your heart. Walk, exercise, drink plenty of water, stop using saturated fats, try to take unsaturated fats, and exercise, and living a healthy life can automatically increase your chances of getting better with arrhythmias. So you can do it by yourself and live a healthy and happy and long life. Take care of yourself. See you in the next lecture.